MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
Good morning, Dr. Tierlink. You're here today to present a very interesting new late-breaking clinical trial. What is relaxin and how does it relate to heart failure?
Certainly. Well, relaxin is a normal hormone that is present in both men and women. It increases dramatically during pregnancy, so women are exposed to high doses of this agent during pregnancy. It results in vasodilation as well as improving renal function during pregnancy, and we hypothesize that those beneficial effects might extend to patients with heart failure as well.
So your study analyzes the use of relaxin in patients with heart failure?
Yes, the pre-relax AHF study enrolls patients who have acute heart failure on the basis of dyspnea at rest or minimal exertion with a normal or elevated blood pressure as well as mild to moderate renal dysfunction.
And this is a phase 2 study?
It is a phase 2B study. It's a randomized, double-blind, placebo-controlled, international, multi-center trial that's dose-finding.
Can you tell us about some of the findings from your study?
Certainly. In the pre-relax AHF study, we randomized patients to 5 dose groups, one of which received placebo, and then 4 of the groups received active relaxin ranging from 10 to 250 micrograms per kilogram per day. In these patients, we evaluated a range of endpoints to try to assess what was the appropriate dose to go forward in phase 3 trials. What we discovered was that 75% of the patients treated with relaxin at 30 microgram per kilogram per day had increased improvement in dyspnea compared to the patients treated with placebo. This was a finding at 24 hours and was sustained at days 5 and days 14 for continuous improvement in dyspnea. In addition to this, we also showed improvement in the signs and symptoms of heart failure and numerical decreases in the length of stay in the relaxin-treated patients. All of this was accomplished with lower doses of diuretics and lower doses of other vasodilators.
You had another interesting finding in your study. What was that?
Well, interestingly, and although it's based upon relatively small numbers, we also noticed that there was an improvement in survival as well as rehospitalizations for heart failure and renal failure. Specifically, in the 30 microgram per kilogram dose, there was an 87% reduction in the event of cardiovascular death and rehospitalization for heart failure and renal failure, with a nominal p-value of 0.05. These findings were supported by the evidence at days 180, where we also noted a substantial decrease in overall cardiovascular mortality in the relaxin-treated patients.
That sounds very promising for a phase 3 trial.
We are very excited about these results, and we are going ahead with the Relax AHF 1 trial, which will enroll patients as a phase 3 study to truly evaluate the efficacy of relaxin using the 30 microgram per kilogram dose.
Thank you so much for your time, Doctor.
Thank you. It's a pleasure.